David, when a patient is diagnosed with stage 4 periodontitis, how successfully can periodontitis be managed?
That's a very good question. We have said before that the stage 4 periodontitis is the most severe and complex to treat form of periodontitis. But the guideline is telling us that despite this complexity, most cases of a stage 4 periodontitis can be successfully treated, maintaining the natural dentition in a state of adequate health and function. But for that, you need to follow a very cautious approach. Patients should be informed in advance of all the treatment options, the associated risks, the different steps, the sequence of interventions. First thing that you need to do is to understand which periodontally compromised teeth are treatable. And it is crucial to assess motivation and adherence to self-performed dental plaque biofilm control from the beginning till the end of the process, and then during supportive periodontal care. And of course, it is mandatory when you are dealing with the stage 4 periodontitis to design restorations that will achieve function, the proper functions and aesthetics, at the same time that it enables the adequate self-performed oral hygiene and also professional teeth cleaning. So it's complex, but it can be done.
Yes, so despite the complexity, it's still possible to manage it. And Moritz, in the previous guidelines from the stage 1 to 3 periodontitis, we were introduced to the step 1, 2, and 3 of therapy, and as well the supportive periodontal care. Do these steps need to be adapted when the patient is diagnosed with the stage 4 periodontitis?
Well, good news for everybody, because people have actually asked me about that and said, you are crazy. You're making a new guideline every year, and now you're changing all that stuff that we have learned. So yes, as you have said, and David has mentioned, there has been a staircase model where basically we have different steps that have to follow one after the other for the treatment of so-called normal periodontitis, that is periodontitis without the complexity that David has so beautifully described. And the good news is, yes, you can largely keep that stepwise model with step 1, step 2, step 3, that is surgery, and step 4. However, it needs to be a little bit modified. But there are a lot of small things, or a little bit bigger things, in the rehabilitation of these very severe cases that can be plugged into the different steps.